Okay, so my research project will be focusing on an exploratory look at the experiences of women with endometriosis in China. So to begin with, I would like to thank my mentor for helping me finding primary resources and also helping me with editing my writing. Also, thankful for my mom for my major source of inspiration. She's also a former endometriosis patient, so I got a lot of knowledge from her as well. So to begin with, what is endometriosis? And to better explain that, I think it will be better if we show you a self-made image of the uterus along with the colon. So endometriosis is a gynecological disorder which the endometrium, as seen here, the inner lining of the uterus, which thickens during time and then falls over during menstruation, grows out of place, grows outside of the uterus, and gets inflamed and adhesion. So in this case, this is one of the most common type of endometriosis called chocolate cyst, as it is developed around your ovaries and is shaped like a dark brownish color, which seems like a chocolate. And common symptoms of endometriosis are abdominal pain, dysmenorrhea, which also means period cramps, change in menstrual cycle. It can be irregular menstrual cycle or suddenly change in menstrual load, pelvic pain, painful intercourse, and infertility. As listed above, these symptoms can be very obscure and hard to diagnose. So it's not uncommon for endometriosis patients to be misdiagnosed for other diseases such as inflammatory bowel disease before actually getting the right diagnosis. And some common treatments for endometriosis are hormonal contraceptives. This can be either taken as medications or can be used as IUDs, as shown on the right. This is placed inside the uterus to release certain chemicals that stop the production of estrogen, so it can stop the endometrium from thickening, therefore stopping the period and some other symptoms. And people can also take progesterone, which is a hormone produced during pregnancy. By taking this kind of medication, your body will stimulate a situation where you feel like you're pregnant, so the endometrium will stop thickening as well. However, there are in some other cases where neither of those treatments comply with the patient, and sometimes patient has special needs. For example, sometimes they don't want to interfere with their fertility. They do something called conservative surgery. And one of the most common types of surgery is called chocolate cyst removal, as stated before, is the removal of diseased masses on both sides of the ovaries. However, in rare cases where the disease is extreme, sometimes a procedure called hysterectomy is conducted, which means the partial or the complete removal of the uterus. However, this is the least favorable situation, as it will affect patients' daily life and patients' health as well. So it's usually not considered the best choice. So I noticed a problem with all the researches I've done that is that I have a limited aspect of the patient's own experiences. So instead of trying to find more resources, I decided to conduct my own online survey anonymously in January 2023. And there were 53 responses that met the inclusion criteria, which was composed of questions collecting basic demographic, their experiences with the diagnosis and treatments, and some of their perspective on the emotional aspect of the disease. So people who fill out the form are divided into a couple age groups, and as you can see, more than 96% of the patients who fill out the form are either between 25 years old to 49 years old, which corresponds with the majority of the diagnosis being diagnosed during the reproductive age. And then participants were asked about the most common symptoms they experience. 66% of participants said that they suffer from dysmenorrhea. Other respondents said that they shared experience atypical symptoms such as change in bowel habits or abdominal pain, or sometimes fatigue and painful urination defecation. And one of the participants who suffers from a typical type of endometriosis called bowel endometriosis told me that she experienced anal pain every time after menstruation. Interestingly, there are 6 patients who told me that they have not experienced any symptoms at all. They didn't find out they had endometriosis until their annual physical. And then the majority of the research participants have experienced their conditions for a certain period of time. As seen above, over half of the participants said they've been diagnosed for 1 to 5 years. 43% of them said have been diagnosed for more than 5 years, and only about 7% of them are relatively new patients. So the majority of the participants are more or less experienced patients. When it comes to choosing the best treatment for the patient, the right to make decision plays a major role in the treatment selection. As you can see here, 64% of the survey respondents make the findings along with their doctors. 15% of the participants decided solely for themselves, 18% of them decided the doctor chose it of them, and only 11% of them never received treatment. So as you can see here, the majority of patients, their personal preferences are considered the priority, but also they're open to professional advices. So treatments vary for each patient, but certain treatments are more common than others, which can be inferred from the question about treatment received. According to the survey, surprisingly, when I was doing the survey, I was expecting more people to use certain medication like birth control or IUD or other kinds of progestin. But however, as shown above, more than half the participants chose conservative surgery instead of any other treatment. As there are some people who never receive treatment, and there are some people who receive alternatives. One of them told me that they have done Chinese medicine instead of the more formal scientific one. Then I asked the participant about the effects of the disease on their lives. So 64.15% of the participants responded that they're mostly disturbed by the pain accompanied with the condition. Well, surprisingly, only 13% of them said that infertility has the most effect, and about 34% of participants consider something else or give some varying answer like fatigue, change on quality of life, etc. Then I made a word cloud to ask them to share their experiences or feelings about the treatment. And as you can see here, the word cloud indicates the amount of frequency that these words are mentioned. The larger the texts are, the more frequently they're mentioned. So as you can see, most of the patients feel positive about the treatments they receive, and also some other patients remind us of certain symptoms to be aware about. And a lot of patients have also mentioned chocolate cyst melanoma, showing how common the condition is. And for the last question, I asked them to share what they want to tell people that doesn't have endometriosis about the disease. And this is also a word cloud. This may not be the best indication of what they're trying to tell, but from the questions, from the response I received, most of them told me that if possible, they want to tell younger women who are experiencing dysmenorrhea or any kinds of discomfort to be open about their experiences and to tell their doctors and seek for professional advice. So what did I learn from this research? A combination of research studies and some primary sources, I found that in Chinese culture, women are commonly define their role as a birth giver. This effectively, Chinese women, if they lose their ability to become pregnant, is mainly seen as something demeaning. And this one may be women who suffer from infertility, suffer from levels of stress, anxiety, and depression caused by both the hormone-related mood swings and also by the treatments and pain and discomfort. And also in Chinese culture, mostly affected by Confucianism, gynecological symptoms, especially something related to women's health, and some side effects such as abdominal pain, dysmenorrhea, infertility, and sometimes medical procedures such as ibuprofen, which is a medication that stops your dysmenorrhea, assisted reproductive technology and even sometimes epidurals during childbirth are extremely stigmatized and seen as detrimental and can disrupt their health and their natural cycle of being a woman. And according to a study that I found about the study of social cultural factors on depression of Chinese infertile women, a majority of them, 88% of the patients have felt reproductive stress, which majority of them coming from themselves, their parents-in-law, their husbands, and over half of them are classified as distress. It is very likely that this long-rooted Chinese traditional main contributor to stresses surrounding infertility can be around Confucianism because the maintenance of the family is seen as the maximum priority. However, if we see from a positive aspect, the study I conducted surprisingly suggests that this cultural perspective is shifting. Most of the study participants are not concerned about their fertility as predicted, and most of them are giving their knowledge of their experiences with younger generation. This suggests we have a more progressive mindset among Chinese women in mainland. Future research should explore education programs for young people about reproductive health so we can help enforce more progressive understanding of women's health in general. Yeah, that's what I have for today.
Skyler, thank you so much for that insightful presentation and presenting to us something that not all of us know as much about as we should. So we have a number of audience questions, so let's jump in. So one audience member is, first of all, highlighting how informative the presentation was and asking if you thought the process of gathering data in the course of your research ended up being somewhat therapeutic or helpful to the people with whom you spoke.
Yes, I've actually contacted with most of the participants after the research was done, and the majority of them felt like they've actually had a chance to speak out for themselves and they feel like they were included because this is a very common type of disease that get undercovered a lot. So I feel like I get the research done and they kind of get their helps as well from telling me about their experiences.
Got it. So interesting and important to know that. Another audience question is asking you about where you think you'd like to take your research next.
That's a very good question. I've actually been thinking about it would be helpful if I'm talking with my mentor right now about publishing this work, because maybe not for the sole medical aspect, but more like for the personal aspect with the researches and some personal experiences, I think which will make this research unique and valuable for publication. I think I'll modify it a little bit based on the criteria and see how it works.
Skyler, it's good to hear that you're thinking about the next steps. And just a final quick question from me. What was the most difficult part of your research?
I was expecting data collecting to be the most difficult one, but that turned out to be the easiest. So the most difficult one would be like forming the research abstract, because I was starting with something rather easier and something rather broad, something just related to the same disease, but it was not until like halfway through the project that I figured out what my abstract was.
Got it.
And I think also time management, because I was also struggling with other school stuff. So it was very hard for me to take time to actually focus on the research projects. But somehow, thanks to my mentor, I still got it done in time. And I think I learned a lot about time management through this process. Kind of makes me feel a lot more efficient than before.
Skyler, thank you so much for the work and the presentation and for answering these questions. I'm sure there will be many more questions unanswered. And if you have such questions, feel free to reach out to Skyler and ask questions in the Q&A. So thank you, Skyler.